Welcome back. As we mentioned, some folks have older dogs, and I think as we get older as Americans, our dogs seem to be living longer and longer as well.
Exactly, but you know, what can we do to make sure Fido lives a nice, long, and healthy life? Dr. Candace Norrell joins us tonight from the U of I Vet Med Clinic, and you know, welcome, nice to see you again.
Thank you, thanks for having me.
And you guys are back into Pet U, which is a great little series of programs you're doing, and this is one of your guys' topics this month.
Next Monday, we'll have it's a lecture series for the community. It's $8 in advance, $13 at this point now, $13 to register for the night, and it's a lecture about geriatric pet wellness.
So dogs are living longer.
Yes.
When do we consider dogs to be in the golden years or getting to that stage?
It's variable based on their breed. The large breeds tend to live a shorter lifespan than the small breed dogs. Cats, the AAFP, or the American Association of Feline Practitioners, has a life stage that's broken it down for practitioners with recommendations based on their age, 7 to 10 being mature, 11 to 14 being senior, and 15 plus being considered geriatric.
Okay, and vet medicine has changed to adapt to that, correct? As
Absolutely. Just like human medicine is changing, we have more specialties being added. We have more opportunities for preventative and wellness care, as well as advanced therapies, even chemotherapy and radiation.
Wow.
So what are some of the common disorders that our pets typically get as they become older?
You know, it's really similar to the same things that people experience.
Really?
Because they're getting older, their metabolism falls. We tend to see some problems with obesity. We'll see issues with arthritis. That's very common, and they're very stoic. Even though your pet may not exhibit clinical signs of arthritis, they probably have some if they're over 10. We'll see metabolic changes such as kidney disease or liver disease. Cats often develop problems with their thyroids where it's upregulated and they'll get hyperthyroidism. So much the same as what we're seeing, and of course cancer.
And stoic means that they don't exhibit the signs of their problems, correct?
It's amazing when we look at radiographically or on an x-ray, cats and their bones will see severe disease, and they appear not to have much pain at all, but comparatively we know that a human would be experiencing a lot of pain. So if we extrapolate from that, then we can probably assume that they're experiencing it as well.
Wow.
So what can we do to help them enjoy those later years and make sure they're comfortable? If we're not sure that they're having arthritis or having the pain, what do we do about that?
Obviously, an annual exam with your veterinarian is extremely important. You have to consider that a year in your pet's life is multiple years in your life, especially as they age. So 1 year, maybe 3 or 4 years comparatively. So not seeing the doctor for 1 year, that's a long time.
Yeah.
So annual exams, blood work for pets that are over 7, we recommend for all dogs and cats, keeping their vaccinations up to date. Even if you're on a 3-year protocol, they still need to have their exam annually. Routine fecal analysis for parasites, heartworm testing for dogs, heartworm preventative for both dogs and cats, preventative for fleas and ticks, and just checking with your veterinarian if you're noticing any clinical signs at all that you feel are abnormal. Once they develop clinical signs, they're often advanced.
And even if your dog isn't exhibiting any signs, another good reason you guys still got to go to that annual checkup.
Absolutely, because like I said, pets are stoic, and their clinical signs will not develop sometimes for years into the disease. And if we get an early diagnosis, or we diagnose before we're seeing clinical signs, then we have a much more ability to do something about that preemptively and prevent those clinical signs or diseases associated with that process from continuing and causing other organ failure.
Well, thank you so much for the information. You guys have got that talk coming up on Monday night.
Yes, Monday night.
So it's the 8th. It's called Pet U. It's at the U of I Teaching Hospital at 1008 West Hazelwood Drive. And how can people get signed up for this, or just show up to the event itself?
They can go on. We accept walk-ins. Yes, you would come into the small animal clinic at the front desk, and you can go on to our website as well. And there's information. Just click on the information for Pet U. It's on the front of our webpage.
Fantastic.
Perfect.
Well, hey, before you leave tonight, I want you to help us pick 2 more winners.
Excellent.
Because our last 2 chatters never showed.
Okay, here's one.
All right. Alyssa Goines, I believe it's Goines. I don't know how to say her last name, but if Alyssa's still in there, she's
our second lucky one.
Illinois Willows, if she's still there as well. We'll find out if they're still in the chat room. Thank you so much, Candy, for coming in.
Thank you for having me.
Thank you very
Enjoy
much.
being here.
If you'd like to see the information again, you know where to find it. IllinoisHomepage.net. You'll see easy a drop-down menu when you go to News at 7. You'll see those interviews there in case you'd like the information again.
All right, stick with us. We're back after this.